Good day everyone, good day ma'am. I am Jacinth G. Aiso and I am with the affirmative side, and this house believes that people should be legally required to get COVID-19 vaccination, especially during this outbreak of a very contagious disease which is the COVID-19. People who are infected with COVID-19 virus may spread the viruses to someone, their friends, family, or someone who are not eligible for COVID-19 vaccination. It could be transmitted through coughing or sneezing. So people who are infected with COVID-19 may acquire long-term health illness or health issues after such infections. It could be long-term breathing problems, heart complications, chronic kidney impairment, and even stroke. And according to World Health Organization or WHO, COVID-19 vaccines provide strong protection against illness, hospitalization, or worse, death. There are also some evidence that being vaccinated will make it less likely that you will pass the virus out to others. There are several types of vaccines being developed, but first, let me explain how do vaccines work. Vaccines mimic the virus or bacteria that causes diseases and triggers the creation of antibodies. These antibodies will provide protection once a person is infected with the actual disease causing virus or bacteria. So the first vaccine is Pfizer-BioNTech COVID-19 vaccine. It is used in individuals ages 5 through 11, which is said 91% effective, and to ages 12 through 15, and is 100% effective also, and ages 12 and 16 rather and older are and 91% effective. The next vaccine is Moderna COVID-19 vaccine, and said to be 94% effective in preventing COVID-19 symptoms to individual ages only 18 and older. In the month of April, currently 2022, the total count of individuals who got vaccinated with at least one dose of COVID vaccine are 65.5% of the world's population, and 59% also to those who are fully vaccinated, and about 22.3% for those who are booster given. We must be vaccinated in order to achieve a herd immunity for COVID-19. Let's see, for example, a herd immunity against measles requires 95% of a population to be vaccinated. The 95% of a population be vaccinated. Then the remaining 5% will be protected by the fact that measles will not spread among those who are vaccinated. We also can apply this method or way to achieve herd immunity against COVID and become COVID-free. There are several aspects of the society that are being affected with COVID-19, and these are economic, education, and also the psychological health of a person who is infected. So after the outbreak of COVID-19, there are a lot of individuals who lost their jobs, business are being closed and forced to quit, and many are forced to quit their jobs for health purposes. So education systems are also forced to stop, and that leads to different types of learning systems like asynchronous and modular type. So there is no such reason that we should not get vaccinated, and the key player for this to be made possible is the government, because they have the such power to said or to mandate everyone for on getting COVID-19 vaccination. And this idea does not So that's it. Kana ko eh. There's no such reason that we should not be legally required to get. There's no such reason for us to not be vaccinated. And this idea is not a selfish type of idea, because it is for the safety and also for the continuation, for the sake of our economics, education, and there's no such reason that everyone would not be legally required to get COVID-19 vaccination, because it is for the sake of the continuation of everyone's life, that there should that after being vaccinated, after achieving the herd immunity for COVID-19, that we will be free to roam around, to get a job, and don't be afraid of being infected with such virus. So that's it. We believe that people should be legally required to get COVID-19 vaccination. Thank you and good day.
Good day, everyone, especially to our respected judge, my worthy opponent, and the audience. I am Mary Grace Ball, hereby humbly express my thanks for your listening. As previously stated, I am hereby standing against the motion. And if I have your permission, I would like to begin by saying that COVID-19 vaccine should not be legally required. Because we do believe not all social groups wanted to be vaccinated equally and willingly. It is somebody who treasures individual freedom, a freedom to refuse vaccination for personal, ideological, or religious reasons. Biblically speaking, we can read from the book of Proverbs, chapter 14, verse 12, that there is a way that seems right to a man, but in the end, it leads to death. The Bible is very clear that we ought to obey God rather than men, and so we cannot sit idly by as laws that violate our beliefs are passed. We will keep our eyes on our hope of glory, and even when it is difficult to seek, to find a way to keep a clear conscience toward God. There are multiple levels at which vaccine mandates interfere with the free exercise of religion. As Christians, we oppose government coercion in this area and support free choice. Moreover, the vaccine was also developed quickly, but over time, it caused many people to suffer from its effects more than we expected. Negative impacts include the increased risk of BPD or vaccine-preventable diseases, outbreaks in low-resource countries where vaccination programs must be halted to prevent the spread of infection. There are also incidents that have been reported in which persons who received the vaccination suffered from its negative effects, and some of them died as a result. Let's take a look at these incidents. According to December 2020 FDA document describing the circumstances of the deaths, one experienced a cardiac arrest 62 days after vaccination and died. The other victim died 3 days later, and the other died from arteriosclerosis after 3 days in vaccination. The document also said in the second death, the participant had baseline obesity and pre-existing atherosclerosis, or a narrowing of the arteries. There were also 4 deaths reported among the trial participants who received a placebo. The deaths represent events that occur in the general population of the age groups where they occurred, at a similar rate, according to the FDA document. There has been a widespread speculation about the side effects of the COVID-19 vaccines, including tragically deaths. They showed the risk of death involving COVID-19 was consistently lower for people who had received 2 vaccinations compared to 1 or no vaccination. However, there has also been some incidents about the number of people who have died as a result of an adverse reaction to one of the vaccines. The Yellow Card reporting scheme has reported that between 9 December 2020 and 8 September 2021, there were 1,645 deaths where the person died shortly after receiving one of the coronavirus vaccines. These cases are the latest to be added to the growing list of sudden deaths to occur during the vaccine rollout. Another recent autopsy report for Camila Canipa, who also died following vaccination, stated that the cause of death could be reasonably attributed to an adverse effect from administration of the COVID-19 vaccine.
To our adjudicator, to my fellow debater, and to all of you watching this video, good day. First of all, I want to introduce myself. I am Genaro T. Aguilar Jr., stands as the Deputy Prime Minister of the affirmative side of this debate about the COVID-19 vaccine. I am in favor of the COVID-19 vaccine because I want to be back in my normal life. I do say that because the COVID-19 virus has effect not only in our health, but also to our livelihood. We cannot only defend these threats to our faith in God, just like what the leader of the opposition said. I am a religious person actually, but defending the situation on waiting and praying that this pandemic will stop would not help us because there are already several aspects of society that are being affected with the COVID-19. Those are the economics, education, and psychological aspects of man. After the outbreak of COVID-19, there are a lot of individuals who lost their jobs, business being closed, and forced to quit their job for health purposes. Education systems are also forced to stop, which leads to different types of learning system like asynchronous and modular types. To slow the spread of the virus, schools closed across the world. 1 year into the pandemic, almost half of the world's students were affected by school closures. Millions of girls in some countries might not be going back at all, putting them into risk of adolescent pregnancy, child marriage, and violence. For school closures to devastated industries and millions of jobs lost, the social and economic cost of the pandemic are many and varied. COVID-19 is threatening to widen inequalities everywhere, undermine progress of the global poverty and clean energy and more. The COVID-19 pandemic has also led to a dramatic loss of human life worldwide and presents an unprecedented challenge to the public health, food system, and world of work. The economic and the social disruption caused by the pandemic is devastating. Tens of millions of people are at risk of falling into extreme poverty, while the number of undernourished people, currently estimated at nearly 690 million, could increase by up to 132 million by the end of the year. Millions of enterprises face an existential threat. Nearly half of the world's 3.3 billion global workforce are at risk of losing their livelihoods. Informal economy workers are particularly vulnerable because the majority lack social protection and access to quality healthcare and have lost access to productive assets. Without the means to earn an income during lockdowns, many are unable to feed themselves and their families. For most, no income means no food, or at best, less food and less nutritious food. The best solution is to stop the damage from happening through the use of tests, treatments, and vaccines everywhere. This will cost only a fraction of the huge economic loss of the pandemic is causing every week. According to Alberto Ghibellini, a senior researcher at the University of Oxford, Oxford's Eurocentre for Practical Ethics, he said that vaccinations against COVID-19 should be required, at least for some groups. Failure to vaccinate would result in penalties such as fines or restrictions of freedom of movement. The less burdensome it is for an individual to do something that prevents others from harming themselves, and the larger the harm avoided, the stronger the ethical case for mandating it. Vaccinations significantly minimizes the danger of causing serious damage or death to others. And because of that, we need to make actions and do what is right. The COVID-19 is the very effective way to get out in this pandemic. COVID-19 vaccines are effective and can lower your risk of getting and spreading the virus that causes COVID-19. COVID-19 vaccines also help prevent serious illness and death in children and adults even if they do get COVID-19. The current COVID-19 vaccines provide strong protections against serious illness and deaths caused by the Omicron and the Delta variants of the virus that causes COVID-19. Being fully vaccinated will also help reduce the likelihood of new variants emerging. We need to reimagine our environment's future and act quickly to address climate change and environmental deterioration. Only then we will be able to defend everyone's health, livelihoods, food security, and nutrition, and ensuring that our new normal is better. The vaccinations also reduces the number of cases, disease transmission, disease severity, need for hospitalization, and deaths. The vast majority of current infections, as well as severe disease and death, occur in unvaccinated people. Prioritizing those most at risk is vital to reduce the impact of the pandemic on people's lives and well-being. Vaccines of 90 to 95% efficacy in keeping people from becoming sick, such as those developed by Pfizer, AstraZeneca, or Moderna, are also expected to be useful in stopping the virus from spreading. COVID-19 vaccines have also proven to be safe, effective, and life-saving. Like all vaccines, they do not fully protect everyone who is vaccinated, and we do not yet know how well they can prevent people from transmitting the virus to others. But having a vaccine is better than waiting to a miracle that this pandemic will begin without doing an action. That is all, ma'am, and thank you.
Good day, everyone. I am Cherme B. Autentico, and I am one of the member of the opposition side, and I am the deputy leader of the opposition. Working with a lot of people that varies in health condition, age, comorbidities, and the things alike, I have come to understand why getting a vaccine should always be an option and not a mandatory thing to do. Taking vaccination as a legal prospect is like a sugar-coated way of mandatory or forceful vaccination, which greatly defeats the purpose of being humane such that it can arise another problem instead of fixing the situation. The economic dip is something that is expected due to the sudden halt of economic activities. However, the world does not only revolve in such concept, because though economy is a huge chunk of our daily lives, we should also not forget components that dwell with it. While we are concerned on regaining our economic status, we should also look deep into the mental, emotional, and holistic well-being of those who refrain from getting vaccinated. Seeing those work of simple transactions because they are not vaccinated and taking the shoes of those who had lost a family member, a lover, or a friend because they did not bear the effect of vaccines in their body. Many people would label them as a selfish without knowing that there is a stigma that lingers in their heart that fortunate people cannot see. Technology has continued to thrive in this era, as it became the primary means of doing the job in this time of pandemic. And people should see the opportunities that resides from it, if they really care to put food in their tables. If people are resourceful enough then, many could land a job, which would provide enough funds to cater their personal needs. This way, we can minimize contact from one another and simultaneously become productive at work. Call center, virtual assistants, online tutor, and many more. There are a variety of options to choose from if job opportunity is our only concern. Also, if you are not qualified for such job, there are also other things you can do that doesn't require much of credentials. Our economy may be at a slower pace than it was before, but from a perspective of a normal person, I don't think that there is a need to rush from economic recovery. Come to think of it this way, our earth is gradually healing itself from those harmful activities we do when we have the liberty. This is the time for us to reflect on the things that we need to stop doing. I am not romanticizing the pandemic. Rather, I want everyone to see the purpose it beholds. Our time has come to think of a plan in recalibrating our ways to build a much eco-friendly living because after all, COVID-19 is a biological problem and we should solve it in a biological standpoint. Legalizing vaccination only disputes the wanted rest our Mother Earth longs for because we focus only on being able to join at parties, attend events that can actually wait. Malnourishment has come to existence even before the pandemic has started, and that thing should never be blamed on the virus alone. Knowing that there are a lot of factors that influence the occurrence of such happening. Using this idea as a reason why we should legalize vaccination is nothing but a line without connection. Because if that is the case, then we should have been legally taking family plans or even taking a change in parliament a long time ago. Forcing someone to be vaccinated does not guarantee that the case of malnourished child will be reduced because even before the pandemic, it has continued to rise in uncontrollable manner. Because after all, I understand why people long for herd immunity. Because after all, who wants to live in a world full of restrictions, right? But on a side with empathy and sensitivity, let us also come to think about people that lives in so much pressure and anxiety due to the fear of not being able to things the way it should be. I don't see a problem with getting vaccinated because it is a freedom everyone can avail. But it should be taken into legal matters because not everyone can afford to take risks and not everyone has a life to spare. It doesn't mean that we will only rely to God, but rather we should seek for conventional methods that fits us the most without oppressing the rights of a person's personal choices. If you come to look at it, those who like to push through the mandatory vaccination are those businesses people that are greatly affected by this pandemic, which in fact are already rich and can live. Well, I see their point, but have they thought of those fairly earning citizens who is unsure of what vaccine may bring into their life? If they can't bear the effect, would the business people cater their hospitalization needs? Can they do a favor of working personal transactions? Can they help in landing them into better jobs? Certainly not. And from that perspective, who can be seen as selfish right now? Definitely those who only seek for their personal interest. Moreover, how come that people can attend political rallies and other social gatherings without the need for vaccinations? Isn't it quite funny to see such situation, or is it the people has utilized this vaccination things as an entrepreneurial aspect? Well, not to burst your bubble, but certain reports have shown how visible corruption is during the time of pandemic. such as the PhilHealth topic I have digested a few months ago. Again and again, let us clarify that vaccination should and will always be a choice and should never be used to legally restrain us from doing things. I am vaccinated, and that is my choice. Some of my friends are not vaccinated, and I respect it. But that didn't option make us any different from one another. We found ways to protect ourselves from the virus. We still are able to find ways to pursue our dreams. And we still had the chance to do the things we love. And that narrative can be applied into a bigger scale. I would like to debunk your idea that people who refrain from getting vaccinated is reliant to a miracle from God. Because they continued to strive amidst the restrictions present in their life. And if they can do that, then so are those with opposite disposition. As they say, if there's a will, there's a way. Seeking for a societal consensus will always be hard.
Good day everyone, I am Teresita Alvarado, one of the member of government side, and I am the government rep. We cannot deny the fact that COVID-19 pandemic is one of the most terrible crises the globe has ever faced. The world has changed because of COVID-19 epidemic. The virus's nature, particularly how it spreads, has changed human behavior, relationship, and styles as well as economic, political, and cultural landscape of society around the world. It has also impacted poverty, discrimination, and inequalities in many parts of the world, not only because COVID-19 appears to affecting poor communities more than wealthy, but also because of the measures taken by states to control the virus's spread, primarily by restricting freedom and movement through imposition of community quarantine, lockdowns, and curfew in many parts of the world. First, to the leader of opposition side, you said that COVID-19 vaccine should not be legally required because not all social groups want to be vaccinated equally willingly. It is somebody who treasures individuals' freedom to refuse vaccination for personal, ideological, and religious reasons. We are not here for our personal gains. We are talking here the economic sustainability and public safety. What if everyone refuses to get vaccine? Do you think there are progress in our society? If you think COVID-19 vaccination is not really the solution, then what would be probably the solution? You said that COVID-19 is a biological problem and we should solve in a biological standpoint. You said that COVID-19 is a biological problem. So how can you solve the problem in a biological point? If vaccination should be an option, would you think everything would get into a normal situation again? And Prime Minister said, there is no such reason COVID-19 vaccination will not be legally required, not for personal interest but for our safety of everyone. Yes, I agree with that, because vaccination is an important way to protect yourself from getting severe COVID-19. Like all the other vaccines, there are risks of complication but severe or life-threatening reactions are extremely rare. The benefits of protection against severe COVID-19 is greater than the risk. Anyone who will get the vaccine will probably be evaluated and closely monitored by health professionals and further minimize any risk. According to the World Health Organization or WHO, COVID-19 vaccine provides strong protection against serious illness, hospitalization, and death. There is also some evidence that being vaccinated will make it less likely that you will pass the virus on to others. The current COVID-19 vaccine provides strong protection against serious illness and death caused by the Omicron and Delta variant of the virus that causes COVID-19. Being fully vaccinated will also help reduce the likelihood of new variant emerging. Deputy Prime Minister, as he said, the COVID-19 virus has affected not only in our health but also in our livelihood. We cannot only defend the streets and our faith in God. The COVID-19 pandemic has led to a dramatic loss of human life worldwide and present an unprecedented challenge to the public health, food system, and world of work. Progress in the country vaccination program can help spur economic activity and boost recovery protection, which would lead to a normalization of monitoring policy. Bangko Sentral ng Pilipinas, BSP, Governor Benjamin E. Jokno said. In addition, The government's threatened vaccination drive against coronavirus disease 2019 COVID-19 ensures economic recovery and granular lockdowns can mitigate the impact of pandemic. According to economists, increased vaccination versus COVID-19 would help the country gradually win the war versus the unseen enemy, which is COVID-19. Full vaccination sharply reduces the risk of COVID-19 infections, severe cases, hospitalizations, and death, thereby reducing the burden on the healthcare system and correspondingly reduces the risk of lockdowns going forward, he added. Ricafort said continued vaccination drive reopening the economy bode well for the country economic recovery prospection for the coming quarters, years in a gradual manner. To sum up, the COVID-19 pandemic has resulted in a significant loss of human life around the world and poses the exceptional threats to public health, food system, and the workplace. The pandemic has caused damage on the economy and society. Moreover, the pandemic has had major impact on the food system, exposing its vulnerability. Due to the border closure, trade restriction, and confinement measures, farmers and agricultural workers have been unable to access markets, including to acquire inputs and sell their goods, disrupting domestic and international food supply chain and limiting access to nutrition, safe and varied diets. Jobs have been lost as a result of the pandemic, and millions of people's livelihood have been compromised. Millions of women's and men's food security and nutrition are affected as breadwinners lose their jobs, grow ill and die with those in low-income nation, particularly the most marginalized population such as small-scale farmers and indigenous people bearing the burden of the consequences. The people should be legally required to get COVID-19 vaccination in order for us to secure the public safety of everyone and ensure economic recovery. Billions of people have been vaccinated against COVID-19. Getting vaccinated is one of the most important things you can do to protect yourself against COVID-19, help end the pandemic, and stop new variants emerging. In addition, the National Foundation for Infectious Diseases said that there are 10 reasons to get vaccinated. 1. Vaccine-preventable disease have not gone away. 2. Vaccines will help keep you healthy. 3. Vaccines are as important to your overall health as diet and exercise. 4. Vaccination can mean the difference between life and death. 5. Vaccines are safe. 6. Vaccines will not cause the disease they are designed to prevent. 7. Young and healthy people can get very sick too. 8. Vaccine-preventable disease are expensive. 9. When you get sick, your children, grandchildren, and parents may be the risk too. Your family and co-workers needs you. Alberto Ginobili is a senior research fellow of University of Oxford. Vaccination against COVID-19 should be required, at least for some groups. Failure to vaccine would result in penalties such as fines and restriction of freedom of movement. The less burdensome it is for individuals to do something that prevent others from harming themselves. And the larger the harm avoided, the stronger the ethical case of mandating it. Vaccination significantly minimizes the danger of causes serious damage or death to others. Vaccines of 90 to 95% efficiency in keeping people from becoming sick, such as those developed by Pfizer, AstraZeneca, or Moderna, are also expected to be useful in stopping the virus from spreading through to a lesser extent. Such advantages would emerge. We need to reimagine our environment's future and act quickly to address climate change and environmental deterioration. Only then we will be able to defend everyone's health, livelihood, food security, and nutrition, and ensuring that our new normal is better.
Good day, everyone. My name is Brenda Nusa, and I am the opposite web of this debate. And I'm going to state my objections to the statement of the government side on the issues that people should be legally required to get COVID-19 vaccination. First of my statement against the Prime Minister In his statement, people should be legally vaccinated to avoid COVID-19 virus, which continues to spread in many countries. But for me, it does not mean that if you are not vaccinated, you are prone to COVID-19, or shall we say high risk of that virus. People have their own decision in life and they know what is best for themselves because they are responsible enough. Many people that are against taking COVID-19 vaccine are still following the implementation of health protocol of the government than the people that already been vaccinated. Vaccination antagonists perceive that vaccination is not necessarily the sole intervention for fighting this disease. They promote basic methods involving public mask usage, which effectively curbs the spread of coronavirus when properly worn. Personal hygiene behaviors such as frequent hand washing and alcohol-based hand sanitizers, physical distancing, maintaining a distance of 1 to 2 meters from each other and avoiding crowded places, and social distancing, like limiting gatherings. These instruments were capable before vaccine use, and the vaccine is not only way to cope with COVID-19 for, for protecting oneself and others around us. Vaccination cannot guarantee the prevention of infection or reinfection, resulting in public resentment against the coercive measure while post-inoculation anxiety continues. So, the second statement is against the Deputy Prime Minister. He said that COVID-19 has effects not only in our health but also in our livelihood. Yes, that is true, but now we are in the moving world. We have a lot of technologies and internet, and there have a lot of jobs that offer at work from home. So people can work without any contact with other people, like face to face, and that is safety and good idea. Except those people, except those poor people living in the province or rural areas, they have limited technologies and internet. In short, they are not knowledgeable enough. So the government decided to open a certain business so that our economy can recover. The key point of this statement is people should find a job without forcing to take the vaccine because people are responsible enough to protect themselves and aware of how the or how to follow the health protocol, and besides, the vaccine is not the perfect solution to recover our economic damage and this pandemic, but also the discipline of the individual. In general, according to FDA, Philippine Food Drug Administration, Director General Eric Domingo, COVID-19 vaccine is already emergency use authorization compulsory or under emergency use authorization compulsory. It means um, the vaccine is not yet fully developed and there have side effects after taking the vaccine. The problem is we don't know what kind of side effects should we get after. So according to him, it is complicated. So especially for those people that have already disease, um, uh, they have more cases here in our country where most of the people taking vaccine suffered after it's because of the possibility of their sustained disease will getting worse. So at the end of the statement, for disagreeing with the COVID-19 vaccine, people have the right to make their decision in life. The autonomy of the people is very important and no one can stop that decision. We have the right to decide and freedom to express our opinions, our reason on why we don't need COVID-19 vaccine. As I mentioned earlier, COVID-19 vaccine is not the only solution to end this pandemic, but also our discipline and responsibility as a good citizen. And that's all of my statement. Have a nice day and thank you very much.
Good day everyone, I'm Albert Alolino. Vaccines are one of the most effective tools for protecting people against COVID-19. Consequently, with the COVID-19 vaccination underway, some may be considering whether to make COVID-19 vaccination mandatory in order to increase vaccination rates and achieve public health goals. With compliance that some private companies and establishments require workers the proof of COVID-19 vaccination before they are allowed to enter their workplace. Department of Labor and Employment DOLE Secretary Silvestre H. Bello III issue Labor Advisory Number 3 Series of 2021 or Guidelines on the Administration of COVID-19 Vaccines in the Workplace. The Labor Secretary has direct DOLE Regional Office and attached agencies to monitor companies and establishments implementing no vaccine, no work policy, and therefore workers to report to DOLE those companies and establishments that are compelling their workers to get vaccinated. The advisory states that covered establishments and employees shall adopt and implement the appropriate vaccination policy in the workplace as part of the occupational safety and health consistent with the guidelines issued by the Department of Health and the Interagency Task Force IATF in accordance with existing laws, rules, and regulation. In addition, covered establishments and employers may procure COVID-19 vaccines, supplies, and other services, and may also seek the support of the appropriate government agencies in the procurement, storage, transport, deployment, and administration of COVID-19 vaccines. No cost of vaccination in the workplace. The advisory also states that covered establishments and employers shall endeavor to encourage their employees to get vaccinated. However, any employee who refuses or fails to be vaccinated shall not be discriminated against in terms of tenure, promotion, training, pay, and other benefits, among others, to terminate from employment. No vaccine, no work policy is not allowed. Thank you.
A future COVID-19 vaccine will not work without sufficient uptake, and some are considering mandates to get that uptake. Some scholars had gone so far as to call compulsory vaccination for all U.S. residents in recent USA Today column. We believe premature mandates won't work. In fact, they could backfire spectacularly. There are several reasons for this. First, once we have own approved vaccine, we will not have enough dozens to go around for those who want to them. Forget mandates, even if goes remarkably well. We will begin by proceeding and distributing tens of millions of dozens, not the hundreds of millions needs to cover the entire United States. Given our limited capacity to produce the vaccine, at first, the more urgent question now is who will prioritize in giving the new vaccine. which is being discussed by both individual scholars and special committees at the National Activity, Academics, and Science, Engineering, and Medicine, and the Centers for Disease Control and Prevention. Simply put, we cannot mandate a vaccine until a broadly accessible. And by the time the pandemic may actually controlled to a degree that a mandate will not be needed.
Good day everyone, I am Rene Aguilar, stands as the government reply of the affirmative side of this debate about the COVID-19 vaccine. Since the start of COVID-19 outbreak, the World Health Organization has worked with countries and areas in the Western Pacific region on the public health measures to slow or stop the spread of the virus. Safe and effective vaccines are an important tool in combination with other measures to protect people against COVID-19, save lives, and reduce wide-scale social disruption. Countries and areas in the Western Pacific region have already completed regulatory approval and started introducing one or more COVID-19 vaccines. After the outbreak of COVID-19, there are a lot of individuals who lost their jobs, business being closed and forced to quit their job for health purposes. Jobs have been lost as a result of the pandemic, and millions of people's livelihoods have been compromised. Millions of women and men's food security and nutrition are affected as breadwinners lost their jobs. With those in low-income nations, particularly the most marginalized populations, such as small-scale farmers and indigenous peoples, bearing the burden of consequences. Safe and effective vaccines are available that provide strong protection against serious illnesses, hospitalization, and death from COVID-19. Billions of people have been vaccinated against COVID-19. Getting vaccinated is one of the most important things you can do to protect yourself against COVID-19, help end a pandemic, and stop new variants emerging. If you might not be agree that the vaccine is the solution of this problem, then what would be? There are some vaccines have risk of complications, but several of life-threatening reactions are extremely rare. The benefit of protection against COVID-19 is greater than the risk. Anyone who will get the vaccine will be properly evaluated and closely monitored by health professionals to further minimize any risk. I agree to the government whip said that we are not here for our personal gains. We are taking here the economic sustainability and public safety. Through the COVAX Global Vaccine Facility and other mechanisms, World Health Organizations and partners are working with governments to facilitate equitable access to the distribution of an initial allocation of vaccine as quickly as possible. The World Health Organizations also recommend that initial vaccination should be prioritized groups at highest risk of exposure of infection in each country, including health workers, other persons, and those persons with other health issues. Once COVID-19 vaccines reach priority groups, countries should vaccinate other priority groups and general population. Data on previous variants shows that vaccines are received hold up well against severe forms of disease, with minor or modest reductions in effectiveness by 6 months after the last primary dose. The World Health Organization also emphasized that the spread of Omicron and future variants will not be solved by vaccines alone. We must continue to do it all to ensure that we have the lowest transmissions possible as the lowest strain on our health system. I agree to the Deputy Prime Minister of the affirmative side that we cannot only defend these threats to our faith in God. As I end this debate, we advise everyone to protect themselves and protect each other. Get vaccinated as soon as possible. Wear a face mask, keep distance, open windows, cleanse your hands and cough and sneeze safely. Take all COVID-19 vaccine doses recommended to you by your health authority as soon as it is your turn, including a booster dose if recommended.